Hi, I'm Dr Anthea Rhodes, paediatrician here at the Royal Children's Hospital and your host today on the Kids Health Info podcast. The latest series really focuses on things that parents and children might encounter that lands them in our emergency department. And one of the most common things that happens in the emergency department is a prescription of some sort for medicine. And then you head home, and it might be all good and well to get them to take that medicine while you're in the hospital, but what if you have trouble getting your kids to take it when you're at home? So here today to talk about some of the common challenges and some tips and tricks as to how we might navigate those is one of our fabulous, very experienced ED doctors, Amanda Stock. Welcome, Amanda.
Thanks for having me, Anne.
From the Royal Children's Hospital Melbourne, this is the Kids Health Info podcast.
So it's quite common that children might be sent home needing medication after they're in the emergency department, and that medication can come in a variety of forms. So can you talk us through some of the different types of ways that medicine actually can be taken by a child?
The common medications like paracetamol, ibuprofen, most antibiotics are generally given in liquid form, and that's what we would predominantly use in the emergency department. Children generally can't really swallow tablets until they're kind of at least 5 to 6. But we can also give medication in a suppository form, which is in the bottom. And a lot of parents are like, oh, I don't want to kind of do that, but it's really effective, particularly when children are vomiting. That can be really good. And also we can crush tablets and we can disperse capsules, meaning that we can open up the capsule and put the little granules in something that would taste good, like apple puree or Nutella.
So when a parent is given a prescription by the doctor or a nurse practitioner in the emergency department, what can they do at that time to just double check that it's going to be something that's right for them and their child in terms of getting them to take it?
Most of us will prescribe liquids in children who are less than about 10 because there's a presumption that they can't swallow tablets. But your child might be able to swallow a capsule or a tablet. So just checking in with the prescription, and if you think that it's unlikely that your child's going to be able to swallow that liquid, then discuss alternatives. Your prescriber may not be used to prescribing tablets or capsules, but if you ask them to do that, then they are probably going to be more than happy to. And they can also write some instructions for the pharmacist to explain to you and your family how to administer that particular medication if it's not in liquid form.
And then what about alternative things like there's gummies? I mean, it feels like there's gummies for almost everything these days. Certainly vitamins and lots of other products are coming in a gummy form, or even chewable tablets are available for some things, dispersible tablets. So what about those options too?
Chewables are absolutely a game changer, and there's a particular brand of chewables that is orange flavoured, and I am yet to meet a child that doesn't like them because they taste good and they're fun. So I think it's probably about being aware of what those options are. The other thing that's important to know or be aware of is that medications like paracetamol and ibuprofen, they come in different strengths, and you can ask your pharmacist for a more concentrated preparation, which means that when you're giving your child the medication, instead of, say, giving them 10 mils of a liquid, you're giving them 5 mils. And then that often just makes things easier,
and
less in.
The same thing can go for antibiotics, for treating infection, for example, making sure you've got that most concentrated version so you're not having to get as much of the liquid in.
Yeah.
What about suppositories? So that's another option. I know that lots of parents might feel a bit worried or uncomfortable about the idea of a suppository. Can you talk us through what it is and how and when it might be appropriate?
So suppositories are essentially delivering medication in a very small little teardrop shape into the anus. And that's, I think, what puts parents off.
So in the bottom?
In the bottom, yeah. And the advantage of the suppository is that it's quick and easy to put in. It can't be spat out, and it can't be vomited out. So a lot of parents will say, well, can they just push it out? And actually that doesn't happen. And so the way we generally recommend suppositories in children who are probably up to about 3 years of age. And we recommend that it's like you get your child in a position just like you would be changing their nappy, and you would put a little bit of nappy cream on the end of the suppository and just with your finger push it into their bottom. And what you find is that it's done really, really quickly. Often I'll say to families when they're feeling a bit sort of hesitant about this, I say, think about how big the poo is that comes out of your child's bottom. I know this sounds a bit kind of weird, but see how small the suppository is in comparison to the poo. So I talk about it like a reverse poo. You're putting something in and it's tiny. It's fantastic to treat fever in infants and young kids where the fever, for some kids, fever makes them vomit. And no matter what we do, we're giving them the syrup and they just keep vomiting. And so for those kids, using paracetamol in a suppository form means that we can treat their fever and stop them from vomiting, because the fever comes down and then the vomiting stops.
And then they're more comfortable. Perhaps then they can take an oral version of the medication the next time around. Yeah, great. And then getting on to tablets. So you mentioned that generally we think about liquid forms or perhaps, chewable and gummies more and more as well in younger children. At what age, typically, if we can even say something's typical, can a child possibly start to swallow a tablet? And what sort of tips have you got?
I think sometimes as parents we think that our children aren't capable of something. So we can start as young as 3. I think probably 6 would be around the age that a lot of children would be able to do it. The way that we would recommend teaching children to swallow tablets is actually to make it really fun and to teach them when they're well and they're not sick. Once children are sick and not feeling great, it's really hard for them to learn a new skill, and also their gag reflex can be a little bit sensitive as well. So make it fun. This is where you would go out and buy some Tic Tacs or some small little lollies, and you would model how to do it by putting it on the tongue, taking a sip of water, and then letting it just find its way down into the stomach. And then as children are successful with the smaller ones, you gradually build up. And the majority of children absolutely love doing this and really they feel really proud of themselves. Just last week I had a little boy who needed antibiotics for an infection in his finger and he was 5, and I said, can you swallow tablets? And he said, I don't know. And then I said, let's try. And he said, okay. And he put it on his tongue. He took a glass of water and then he swallowed it and then stuck out his tongue proudly to show me that it was gone. Sometimes
you don't know until you try. And that idea of giving it a go without the pressure of a child when they're really sick or you're at home and you're very stressed is a really important tip as well. And we'll pop some information in our show notes for people listening who might want to read a bit more about how to teach their child to swallow tablets, and then some good video links of that as well. So that really brings me to another question. You mentioned how, it's good to try and focus on learning new skills when you're well. So one of the challenges I think that happens with trying to get kids to take medicine when they're sick is everyone's a bit stressed about it. Yeah. And it's not uncommon that you find yourself going, you've got to take this, or we'll have to go back to the hospital, or you're going to have a needle. So how would you sort of advise parents to navigate that?
I think the thing is that children are wonderful at detecting our uncertainty and our distress, and so there can be a little cycle that gets set up. And I think it's something that we have to practice as parents, but we always have to remind ourselves that we are in charge of our children. Our job is to help them to get better and to feel better. And so even if on the inside we're feeling despairing and frustrated, we really, I guess it's just about us, I suppose, faking it until we make it and showing with our body language that we mean business and doing that in a calm way. So I sort of think about it like often, when our kids aren't wanting to take medicine, we're talking a lot and we're giving lots of explanations. And I sort of think, what do we do when we want them to pick up their toys or take their bag to kinder? We just ask them. We say, it's time to go to kinder and let's put your backpack on, or it's time to clean up your toys. So in the same way, we're just keeping it really business as usual. You're sick. The medicine is to make you feel better, and here is your medicine. So as little explanation as possible. So this is a job that we're doing just like we do other jobs.
So keeping it practical, but also, I guess, a bit not negotiable.
Negotiable.
Obviously we work with our kids and we're trying to empower them and, find a way that we can work together to get there. But you're absolutely right. They do sniff out, uncertainty very well.
So well.
And then the minute there's a feeling that this is negotiable, the negotiation will start, as a way to sort of do something else. And sometimes I think as a parent, you find your offerings go up and up and up. Oh, have this and then you can have this, or then you can have that, or just take it and I'll buy you a toy. And next thing you know, you've sort of found yourself committing to a whole bunch of things that aren't realistic.
And the longer I think we spend, the harder it becomes. And children are the most incredible negotiators, and they're also excellent procrastinators as well.
So let's say someone's tried all of those things and they're still not winning. And there's a couple of situations that, I can think of, and we might talk about each of those. There's the bolter. So, the minute you're bringing it up, they're out the door.
Yep.
There's just the point blank refusal. So maybe you got there last time with a bit of negotiation and for whatever reason, maybe the medicine had some side effects and they felt a little bit sick in the tummy, or maybe they really didn't like the flavour and they're like, I'm not doing that again. Or you managed to get them to take it and they spit it out. So the spitter. So even with all these different strategies, sometimes you're still having trouble.
Yeah.
So for each of those things, perhaps, what should parents try next?
Often what we find, Anth, is that children haven't been able to take medication at home. They come into the emergency department and then we're able to give it to them. And as parents, you can feel really deflated. And it's really just about the fact that we are someone new and we have a little bit of an emotional sort of space from the child. So in that situation, if your resolve isn't effective, then is there a friend or a family member that can give that medication on that particular day?
So some sort of circuit breaker.
Yeah.
Ideally someone else in your community.
Possibly.
And then, as you say, sometimes that might even be a visit back to the pharmacist.
Might be.
Or even to your local doctor.
Yeah.
We would try not to come back to ED for that. But, if your child's really unwell and you absolutely cannot get them to take medication, then seeking medical advice about alternatives would be something that you might have to think about.
It becomes quite difficult as children become bigger and older. Because there's only so much that we can restrain them. So then it's really more about unpacking what is it that's leading up to them refusing to take medication.
And sometimes that can be really quite a complicated process. It might have all kinds of things behind it. Perhaps there's been a traumatic experience, perhaps there's some anxiety. So sometimes those conversations are really complicated and might take extra help and input from others, a psychologist even, for some children and young people, and improvements over time.
Sometimes it can be as simple as the flavour or the texture, and asking your child, how do you think it would be easier for you to take this medication? What do you think? And sometimes we can be really surprised by what our children come up with. I've heard of children sprinkling the granules from the capsules onto little chocolate melts and having it that way. So if we ask our children, sometimes they might be able to offer us a suggestion that works for everyone.
Sometimes we do get stuck thinking the tablet or capsule has to be swallowed as it is.
It doesn't have to be.
So understanding what can be crushed, can that capsule be opened, can the granules be sprinkled on things, teaspoon of yogurt, Nutella, peanut butter, if they're not allergic to those things, obviously, might all be options.
Absolutely.
And your doctor or your pharmacist can often give you some really good advice as to, that's going to be fine. That's not going to change the way this medicine actually works, as long as it gets into the tummy so that it can do its job.
Yeah, and I think also when you talk about the children that are flat out refusing, as a parent, you're doing your best, and we see a lot of parents that come into emergency and they feel like they've really failed, and sometimes it's just difficult, and that's why all these resources are there to assist you.
Yeah, that's right. And I think having this chat today, lots of people will listen and go, oh, I'm not the only one who has this trouble.
Yeah, it's really tough.
What about the spitter? That's perhaps the last one I want to cover off. Yeah. So you've kind of managed to get it in, and I think this is common. Well, it might be with infants, but certainly toddlers. They may or may not realise that you're squirting in the medicine, and they obviously don't like the taste, and the minute it's in, it's back out.
The key is to see if you can get the smallest volume possible. So, as we said, getting a concentrated formulation of whatever medication it is, and then we're giving, with a syringe, really small amounts. So we might be doing, say, if you've got 5 mils of medication, maybe we're putting in 1 mil at a time, and we're also putting it in to the side, just the inside of the cheek, rather than squirting it in one big go down to the back of the tongue. Because if we just squirt it in one big go, often there's gagging, and that's when the spitting happens. So it's kind of like little bit, little bit, little bit, little bit. And then if there's still spitting, we've got to be thinking of another formulation. Yeah, tablets, capsules.
Great tips. And I think when you see some of the amazing nurses down in the emergency department who are so skilled at this, drip, 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 into the cheek, and it's like they've barely even noticed that anything's gone in, not tasting it as much because it's not hitting the tongue and the taste buds, and as you say, not setting off the gag reflex.
Yeah.
Lots of great tips there today, Amanda. It is really a common challenge for families at home, and as you say, very stressful at times and can make people feel like they're failing.
Yeah.
But really important to know there's practical things you can do, and at the end of the day, if it's not working, a visit to a healthcare provider to think about, is there a different version, formulation, even just another flavour that might be something you have more luck with.
Yeah, lots of options. I think that's really what we want to convey, isn't it? There's lots of different ways of doing it.
Amazing. Thanks so much for having this chat today.
Pleasure.
Great as always to see you.
Thanks.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.